Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I am Professor Ahmed Adam. You are welcome to this parasitology lecture. It is about hermaphroditic flukes and specifically about Clonorchiasis. Just to refresh our mind with the helminths, which are the parasitic worms. They are classified into nematodes and platyhelminthes. The platyhelminthes are classified into cystodes and trematodes. And these trematodes are classified into dioecious worms where the sexes are separate, males and females, like schistosoma. The other group is the hermaphroditic flukes where the worm contains both sex organs, males and females. These are liver flukes, lung flukes, and intestinal flukes. They are so named according to the organ or system infected. The liver flukes are two families, Fasciolidae, comprising Fasciola hepatica and Fasciola gigantica, and the other family is the Opisthocercidae, which comprises Clonorchis sinensis and Opisthocercis viverrini. They infect humans and other animals, causing liver and biliary system diseases. Clonorchiasis, this is a parasitic disease, which is a foodborne disease caused by the fluke Clonorchis sinensis. This worm is also known as Chinese liver fluke or Oriental liver fluke. The worm infects the fish-eating mammals, including humans. It is the only species in the genus Clonorchis that causes human disease. The adult Clonorchis sinensis is flattened and lance-shaped, as you see in the picture. It measures from 10 to 25 millimeters in length and 3 to 5 millimeters in width. Transmission, the infection takes place by ingestion of the metacercariae. Metacercariae are the infective stages. These are found in cysted, raw, or undercooked freshwater fish. Freshwater fish is the second intermediate host. This is a life cycle starting from egg passage from a patient into water. If this water is fresh, the eggs will be ingested by the snail, which is the first intermediate host, and then they hatch in the snail into miracidia, and the miracidia develop into several developmental stages until lastly they reach the stage of cercariae. So the cercariae then showered from the body of the snail into water. They swim for some time, and they're going to be encysted in the flesh and skin of freshwater fish. So when they become encysted, they are known as metacercariae, and these are the infected stages. If such a fish is eaten by a person, raw or undercooked, the infection takes place. In the digestive system, especially the duodenum, the metacercariae are freed, and the outcoming larvae migrate to the biliary system via the ampulla of Veta, and in a month's time they become adult and they release eggs from 1,000 to 2,500 eggs per day, and they live for about 20 to 30 years, and even 50 years was reported. So here the life cycle in writing. The pathogenesis mechanism of disease, the clinical manifestation are related to the worm load, so the number of worms. Most of infection are light and asymptomatic. The clinical manifestations result from the pathology of inflammation, intermittent obstruction of the biliary ducts, mechanical injuries resulting from worms feeding on mucosal tissues of the biliary tree, the toxic effects of worms' metabolic products, secondary bacterial infection as well. In mild cases, manifestations include mild abdominal symptoms like abdominal colic. And as I have just said, that the adult worms can survive in the biliary tract for about 20 to 30 years. The clinical manifestations depend on the worm load, how many worms are there. So in heavy infection, the worms should be more than 1,000 flukes. And if the course is chronic, this results in various complications in the liver and biliary system, including cholelithiasis, gallstones formation, cholangitis, inflammation of biliary tree, cholecystitis, inflammation of gallbladder, pancreatitis, and liver abscess, and rarely but seriously cholangiocarcinoma, that is carcinoma of the bile duct. Growth retardation, especially in children with heavy infection due to malabsorption, and that leads to malnutrition. The clinical presentations, they include right hypochondrial pain due to the liver and biliary system infection, headache and dizziness, hepatomegaly, jaundice, and malnutrition in chronic infection. So you see the pictures. Diagnosis, clinical assessment, the laboratory investigations, the specimens to be collected, stool, gallbladder contents, and duodenal aspirate. Gallbladder contents and duodenal aspirate in case of in case endoscopy is done. Then microscopically, the egg is oval in shape with operculum at one pole and a knob at the other. So you see the picture. The eggs of Clonorchiasis are practically indistinguishable from the eggs of another worm, which is Opisthochis viverrini. Also, the adult flukes were recovered as surgery during surgery, and also pass after antihelminthic treatment. The treatment is by praziquantel drug, a dose of 25 milligram per kilogram body weight 3 times a day for 2 to 3 consecutive days. Prevention, improvement of personal environmental hygiene, avoidance of eating raw or undercooked fresh water fish, and thorough cooking of fish adequately. The internal temperature of the flesh should be 63 degrees Celsius or more. Health education is important, and adoption of hygienic practice. By this, the lecture is over. I hope that it is understandable, and I wish you all the best.